Okay, so it is 4 minutes past 9. I think let's make a start. People are still joining us. I can see from all across Europe. Good morning from Wales, Warsaw, Bern, Krakow, from Algeria as well. Welcome. So good morning and welcome to everyone. And thanks for joining us today for the second virtual event of the European Health Policy Group. I'm Rocco Friebel, and I'm an assistant professor of health policy in the Department of Health Policy at the London School of Economics, and one of the organizers of today's event. Just a quick moment for housekeeping. I know Lucy has already put some information into the chat, but maybe just to reiterate. So we have muted everyone by default, so we won't be disrupted by any latecomers. And I would like to ask you to keep yourself muted during the presentations to prevent any interruptions. But if you submit a question to any of our speakers, we will ask you to unmute yourself and to ask this question. So hopefully this will aid some nice discussions and communication to have several voices heard here on this event. You can also choose to have your camera on or off, but we would be delighted if you would keep your camera on because that will give the speakers a feel of a real audience rather than just speaking to blank boxes with names. You will see prompts popping up in the chat box throughout the event, which are there for your interaction. So please follow these instructions if you have any questions and comments. And then finally, we will be live tweeting throughout this event. So please include @LSE Health Policy in any of your own posts to join the conversation. So with that, with the housekeeping done, as I said, I'm welcoming you all. I'm very pleased that we have had such a great response to this online event. So currently we have more than 220 registrations from academics, policymakers, people working at NGOs, people working in the pharmaceutical industry, and who are based all over the world in a fantastic lineup of speakers. And the format of today's event will be slightly different from the physical meetings of the European Health Policy Group. Namely, that we will start each session with a presentation of the research paper by one of the authors, and this will be followed by a discussion, and then we will move on to the chairs to field any questions. And for those of you not familiar with the European Health Policy Group, we are a multidisciplinary network that aims to stimulate international collaboration and learning in the field of health policy. The group was founded by Professor Gwyn Bevan and Dr. Adam Oliver here at the LSE. And this year actually marks the 20th anniversary of the European Health Policy Group. Unfortunately, COVID did not allow us to meet in person, to arrange for celebration of the active contributions that have come in over the last 20 years. But I'm sure we will repeat that once COVID is under control, hopefully next year, if things go to plan. But the overall objective of the group, of these meetings, is to essentially learn about the experiences of different countries and learn from perspectives of other disciplines, and to foster cross-country collaborations and opportunities for collaboration between authors. So for today's event, we will have 4 chairs in total. Alongside myself, I'm joined by Zeynep Or, who's a research director and economist at ERDIS in Paris, Anna Niczynska, who is assistant professor at the Faculty of Economic Sciences at the University of Warsaw in Poland, Alexander Torbica, who's an associate professor at the Department of Social and Political Sciences and the director of the Center for Research for Health and Social Care Management at Bocconi University in Italy. And finally, Cornelia Henschke, who is deputy head of the Berlin Center of Health Economics Research at the Department of Healthcare Management at the Berlin University of Technology in Germany. So let me hand over to all of you to also allow you to say a few introductory words. Zeynep, why don't you go first?
Thank you, Rocco. Thank you. Good morning, everybody. It is such a pleasure to see so many names. I wish we could be together in the same physical place. So I would like to thank Rocco and also the LSE team for making this organization today, and all of the participants and the great papers which will be listening today. I just want to say that for those who've never been in one of the European Health Policy Group meeting, is that we look very much forward to learn from the papers, but also we look to learn from the audience as well. So I know it is difficult online, but don't be shy, and please ask questions from the chat box, and you can also share your own country experience about the subject discussed. So we are very much interested in what is going on in your own country. So I'm looking forward to this interesting papers and the discussions today. Thank you.
Thank you, Zainab. Cornelia?
Yeah, so good morning, everyone. So I'm very delighted to take part in the meeting and to share a session today. So as we really have a broad spectrum of topics dealing with our healthcare system and also its reactions to the COVID crisis in different countries. And while our aim is, on the one hand, to discuss the excellent research papers you submitted, on the other hand, we want to discuss challenges and opportunities that arise from the COVID crisis, and also identify aspects that we can learn from each other, as Zainab said. So I'm really looking forward to stimulating discussion with all of you. And thank you so much, Rocco, and also the team for providing us with the opportunity to take part in this meeting.
Yeah, thank you. Thank you. Anna.
Hello, good morning. I'm very happy to be part of this event. It's my debut, actually, because I'm a newly recruited member of the group. And I'm very much looking forward to this meeting, to the discussions and to the sessions today. And thank you, Rocco, for the opportunity to chair one of them. I hope I won't disappoint you.
I'm sure not. And please all don't thank me yet. Let's keep that for the end of this of this event. A lot can go wrong. So yeah, the theme of today's event, as Cornelia has just mentioned, is really the impacts of COVID-19 in Europe, perspectives from the social sciences, which will focus on a number of key issues and challenges faced by health systems and its stakeholders across European countries. This includes how COVID-19 impacts on the mental and physical health of the population, the dynamics developed by hospitals to address surges in demand from COVID and non-COVID patients, particularly when systems lacked resilience due to policies that have previously weakened the structures. We will cover research that puts the patient at the center by looking at unmet needs, and we will learn about the delivery of care and the changes directly impacting on patients. And finally, we will hear about research that looks at the lessons that could be learned from this pandemic, particularly with regards to strengthening the resilience of health systems into the future. In other words, we can expect an insightful and thought-provoking event, and I really hope that everyone is going to contribute and share their experiences and insights. However, before we start with the sessions focusing on individual research articles, I would like to use this opportunity to introduce our first keynote speaker of the day. It is really a real privilege to welcome Professor Christos Stylianides, who was European Commissioner for Humanitarian Aid and Crisis Management from 2014 to 2019, and EU Ebola Coordinator from 2014 to 2016. He assumed these roles, having previously served twice as the government spokesperson of the Republic of Cyprus. As EU Ebola Coordinator, Professor Stylianides played a key role in the international efforts to contain the Ebola outbreak in West Africa, coordinating all European policies and the EU's and member states' responsible services. He was one of the first EU officials to visit the affected areas in West Africa at the peak of the outbreak and used his office to raise global awareness about Ebola, as well as initiated the regional cooperation, which was key to bring the Ebola outbreak under control. As Commissioner for Humanitarian Aid and Crisis Management, Professor Stylianides greatly contributed to the EU's role as a global soft power and was characterized by as the humanitarian face of Europe across the globe. He took important initiatives and implemented policies to address humanitarian crises from across the globe, led actions to strengthen the humanitarian development nexus by establishing better connectivity between cross-sectoral efforts to meet the UN Sustainable Development Goals. And he promoted innovative instruments to respond to humanitarian crises, such as cash and voucher schemes. Recently, he has joined the Department of Health Policy as a visiting professor, and Professor Stylianides will share his critical perspectives on the governance of the COVID-19 response in the European Union today with us. Following his talk, we will be hosting a Q&A session, so please submit any questions that you might have via the chat function. So it's an absolute honor to have you kickstart today's event, Professor Stylianides. Over to you. You are still on mute?
Everything is okay?
Yes, now I can hear you. We can hear you.
Good morning, everybody. And first of all, I would like to thank Professor Rocco Friebel, if I'm correct, about regarding pronunciation, and of course his team for this excellent initiative. And I'm really honored because I'm part of this event today, because it's really very timely. At the same time, thank you, Professor Rocco, for your kind words about myself. And as you know, all CV's introduction is a little bit higher than the reality. Thank you again. I would like to start my intervention, called my speech, and to say 3 words, especially because of my role in crisis management many years, not only due to my political background, but also due to my medical background. 3 words: preparedness, preparedness, preparedness. And I started my intervention through this word, preparedness, because through my experience, I realize that nobody can deal with any crisis, outbreak, pandemic, epidemic, pandemic, especially in medical field, in health field. Nobody can achieve anything without preparedness, prevention, and mitigation, without specific plan regarding preparedness. And this is why I insist on this word, because for me, it's a sort of obsession. Now, I can proceed through some points which can describe the situation in Europe, but also globally. First point, we have to recognize, we have to admit that the current pandemic is really unprecedented. And this is my strong conviction, because as Ebola coordinator, I dealt with a very difficult outbreak in the 3 affected countries, especially in 2014 in West Africa, Liberia, Sierra Leone, and Guinea. But the current situation is completely different. My second point, in such a magnitude of outbreak, we need, under any circumstances, a coordinated global response. This is the only way to be more efficient and effective, not only in each continent, not only in each country, but even in each region, even at the local level. And at the same time, nobody can deal alone with such a magnitude just at the national or even just at the continental level. And this is why we need to start a very sincere discussion in-depth critical reforms of the WHO. My third point concerning European response. As President of the Commission, Ursula von der Leyen recognized and admitted, and now I would like to use her statement, during the first stage last spring, 2020, we did not manage to offer the necessary solidarity to our member states. You remember, especially at the time, Italy and Spain. And of course, you remember the major problem of ventilators in some Italian hospitals in North Italy. So we had a lot of weaknesses in the first stage of the pandemic to react with effective solidarity on the ground. My fourth point. Fortunately, in the second critical stage concerning the vaccines, as EU, we decided to be together by all means. And also, fortunately, we started in June 2020 a real common European response about the purchase of the vaccines. We definitely face some critical problems in the process of this purchase, in the implementation of this project. And this is why we face a very problematic situation, especially regarding liability and production. But these two words, I think, is so important in our discussion for the next period in order to understand how we could deal effectively and how and where we failed in our response to this pandemic. Regardless of our common European response, however, even the current figure, after a lot of improvements on the ground, the current figures and the comparison between the European Union and the UK, US, Canada, but particularly with Israel, is really disappointing for us. So we have to start a very sincere and open discussions to identify the reasons behind this problematic situation, and regardless of some achievements, especially in the situation after April 2021. But why? Because the state of play of the rollout of the vaccination has definitely created a lot of mistrust against the European institution and sometimes against the European project as a whole. This is my real fear, because I remain really pro-European, and because I strongly believe that this is the only way for European nations and countries to go further in the future. Definitely, we have to insist on and defend the common European response against any effort from Eurosceptics to return to a nationalized response. And frankly speaking, one of the lessons of this crisis is that nationalization does not work, in particular, of course, within the EU system, because Britain, Israel, USA is completely different case. And because of these delays, which already admitted by the President of the Commission, and this is, I think, it's a sign of her leadership. No doubt, they created a lot of financial consequences and impact for European companies, and especially for individuals, regardless of this really excellent new instrument of the Resilience and Recovery Fund. So in this open discussion and dialogue among our member states and of course institutions, we have to focus on two crucial points. First, what do we mean by a common European response in real terms, and especially when we face such magnitude of a pandemic? And second question, how can we overcome the weaknesses of a very heavy machine during a real war emergency period? And now I think you already understood that I mentioned the machine of the European institutions. And how can we deal with all aspects of the problem as a real crisis management authority? Dear friends, ladies and gentlemen, EU states are too integrated to manage the crisis separately and not integrated enough to do so collectively. And here, there is a need, the division of roles. There is a strong case for building collective EU capacity to respond to major cross-border health challenges through, first, early warning, second, joint research and procurement, and of course, stockpiling of medical supplies. I mention all these things because I strongly believe that if we were well prepared, we definitely didn't see the problems of ventilators in North Italy, and we didn't see the lack of PPEs in many areas in Europe during the first stage of this pandemic. So it requires a war-like mobilization with a speed of decision-making and administrative action beyond normal state institutional practice. In any pandemic, this lack of speed can be lethal. Professor Rocco, in his introduction about me, he emphasized on my role as a former EU Ebola coordinator, especially during this outbreak in West Africa between 2014 and 2016. And I wanted to make a sort of comparison between the two different issues, Ebola outbreak and the current pandemic, COVID-19. I strongly believe that we have to say that it's difficult to make a real comparison and to see real similarities with a really different magnitude of outbreak. But in both two cases, we saw the problems of the international system, the weaknesses of our coordinator at the international level, WHO, and also we saw the lack of solidarity, even among EU member states at a critical time. So Ebola is different than COVID-19, but the problems more or less are the same about our dealing with such problems, pandemic or epidemics. And through this, a sort of comparison, as I already said, I would like to raise 3 points. First of all, we have to continue in a very speed way the reforms of the WHO. Because now, in our current situation, and especially in 2019 and 2020, and regardless of this slow reaction and response by WHO, frankly speaking, their reaction was better than in Ebola outbreak in 2014. At that time, WHO was completely collapsed and the situation was getting worse day by day without the international coordinator. So what we need at this level, beyond critical reforms inside the institution, we need a new global mechanism like climate change agreement to mobilize during pandemics, and of course, in order to facilitate fair distribution of vaccines and medicines, and also to deal with a big challenge to be together, to act collectively. I'm really glad because I saw the initiative by the European Union and especially Prime Minister Mario Draghi and Ursula von der Leyen about the next G20 meeting. You know that Italy has the president of this, and I saw that there is an intention to adopt a so-called Declaration of Rome, which made up of 16 guiding principles focused on fair distribution of vaccines, wrapping up production, and the possible use of compulsory licenses. I think this is very important, and in the same line as I already referred to this critical reform at the international level. At the European level, because of Ebola outbreak, in 2016, we set up the European Medical Corps, and was the EU main response to the Ebola outbreak and to the main challenge of undercapacity. EMC remains a part of the European Union's comprehensive approach to disaster and emergencies, and is now part of rescEU, European Civil Protection Mechanisms, and no doubt that this allows for mobilization of a range of medical capacities. rescEU and the European Medical Corps remain very efficient instrument, especially in disaster management, in forest fires across Europe and outside, but also for any other disaster management. But through this new experience of COVID-19 pandemic, I strongly believe that we recognize some other aspect which could go beyond an order of rescEU and European Medical Corps. So, as a European Commissioner, I propose REST-EU, and I propose an expansion of REST-EU during the law process and the dialogue between European Council, European Parliament, and European Commission. But I think it's now high time to discuss if this discussion is not possible or is not so effective and efficient as we expect. Maybe it's a good idea to establish a new medical agency which will focus only on health emergencies inside and outside Europe. I would like to stop here because it's very important to have a Q&A, and I would like to conclude my intervention through, once again, 3 words: preparedness, prevention, and mitigation. This is the guidelines for a crisis management, and without these 3 words, we cannot deal even with a very small crisis, even very close to our authorities. Thank you so much for your attention.
Yeah, thank you so much, Professor Stylianides, for your insightful...
I prefer professor in practice because I'm not a typical academic professor.
All right, Professor in practice, thank you so much for your contribution, for your insights. So I think now is really a good time. We still have about 20 minutes for a Q&A session. So please submit your questions via the chat, and I will ask you then to come forward and to ask the question. Maybe, given that I'm sharing the session, I can just jump in with the first question for you, to use this opportunity and ask a question before I go into the chat. And so
you have the privilege.
I have the privilege to ask the first question. Yes, just to pick up on one point that you mentioned. You are, on the one hand, you said one of the lessons that we have learned from this pandemic is that nationalization is not working, does not work. But on the other hand,
yes,
you also fear, or you also identified a lot of mistrust. So how can we bring those 2 elements together to actually develop something, a stronger, plan for the future? How can we convince member states to overcome the nationalism and the mistrust that they have? Because ultimately the way forward, the way you describe it, is more integration. It is more, perhaps handing more powers to the Commission on health questions than it is currently the case. So in practice, how can we move this forward?
Yes, very in practice. And thank you for your question, because it's really a question which focuses on a very important aspect of the European Union as a unique project in a humanity. Definitely, I insist on my remark regarding nationalization and regarding this illusion that nationalization is the way for the European member states to deal with pandemics or health emergencies, because I know well, not only from my small country, not only from a medium member state like Greece, like Austria, like other medium countries, that without the common European response, I'm sure, because also of their financial ability and of their financial weaknesses, maybe now they will face similar problems like African countries and other countries, which unfortunately are completely out of the state of play regarding vaccines. So it's a sort of gift to see this real solidarity about vaccination, about vaccines among member states, and frankly speaking, a real fair contribution regarding vaccines. My second point, why nationalization is not a solution for EU member states. Because during pandemics, and we experienced this concerning ventilators in the first stage and PPEs also in the first stage, you need a lot of equipments and you need amount completely beyond business as usual. And nobody can deal with this critical cost and critical amount of products without a support of a European institutions, of a common European response. I remember, and this is why I proposed and we established Rescue in the forest fires field and also in floods and so on. When our member states, they try to prepare themselves in preparedness and prevention regarding this disaster management, they realize that they need a lot of money, maybe beyond 3 or 5% of their annual budget in order to be good, well prepared in the disaster management about forest fires and floods. So you can imagine as a medium, small countries, even Germany. I remember when Germany faced this forest fire just outside Berlin, and they didn't have enough preparedness in order to deal, and this is why they needed our common European response, planes from France, helicopters from Greece, from Croatia, even from Italy and Spain. And I remember my engagement in a very rare forest fires in Sweden. If I remember rightly, 2019 summer. Sweden, you know, is a very wealthy member state with a lot of capacities and capabilities, but we realized on the ground that even these so high-level member states, they didn't have enough ability to deal with all these problems in disaster management. So there are a lot of cases, there are a lot of examples that we need this common European response instead of a national way of thinking disaster management, and in particular in health emergencies. As commissioner, I established an excellent initiative, MODEX, which is an annual exercise on medical field. And I remember the cost of this exercise and the inability of our member states to participate in this MODEX without support of the European Fund. So we need each other, we are in the same boat, and we have to be together.
Thank you so much. And with that, I would like to hand over to Mirella, who has asked a question. Mirella, would you please unmute yourself to ask your question?
Okay. Thank you, Rocco, and of course, thank you very much, Professor Stylianides, for your thoughts, for your great thoughts on European solidarity. I'm a real proponent of concerted action. But my question is, I wonder whether a global crisis does not also require a global move of solidarity. And with that respect, I wonder what your opinion is on the idea of having waivers for COVID vaccine patents in order to allow countries in Africa, and for example, India. You see the catastrophe has come already with many deaths. What is your opinion on having waivers for the patents of COVID-19 or COVID vaccines?
I totally agree with you about this very important problem regarding vaccination of countries in Africa, in Asia, in Latin America, and everywhere. And unfortunately, it's a very painful sign that there is no fair distribution of our vaccines, and this is why we have to deal with this problem, because it is a lack of solidarity. But at the same time, if we see new mutations, we cannot deal with this problem even in Europe, even in USA, even in Russia, even in China. So it's another illusion if we believe that we can deal with such pandemic only in our countries, only isolated inside our borders. And this is why I already stood against this nationalized way of thinking. About the waivers of the patents, I really agree with President Biden, and I strongly believe that it's a big challenge for all of us, and this is why I already mentioned and proposed this new global agreement, a sort of global governance, new order governance regarding pandemics and health emergencies. And definitely in this agreement, we need an aspect which could deal with this problem of the patents and vaccines. Otherwise, this agreement will be so small for such big problems. And of course, at the same time, I strongly believe that we have to start this discussion immediately, but with all stakeholders including. Why this? Because we have to protect the competition among critical pharmaceutical companies, and of course, we have to protect the innovation and the research and the role of patents in our world to see more research in many medical challenges. And this is why we need to talk about compensation for some of the pharmaceutical companies and so on. It's a very big discussion. I think we don't have enough time to talk a lot. But I think President Biden's approach is more or less close to the hard reality on the ground, and it's a really very hopeful approach to see as soon as possible real results in this really difficult challenge.
Thank you very much. Thanks.
Thank you. And with that, I would like to hand over to Alex Christopoulos, who would like to ask a question as well.
Oh, hi. Good morning, Rocco. Good morning, everyone. I would like to ask a question about mandatory COVID-19 vaccinations. There's a discussion about mandatory vaccinations for healthcare professionals in Greece at the moment. Could the experts in the panel share some thoughts on this subject? Thank you.
Thank you, Alex. It's a democratic right for anyone to accept or to reject vaccine. But at the same time, my personal opinion is that in some critical fields, we have to see a real mandatory for vaccination. For example, I'm coming from a medical background, and I strongly believe that anyone who engage in any treatment for COVID-19 patients has to be vaccinated. And also in some other critical professions or other fields where the people are engaging in this very important job to deal with COVID-19 problem, and definitely they need this vaccine in order to be more probably efficient and effective in their job. And at the same time, of course, it's a democratic right, but also in our societies, we decided to stop our cars in front of red lines and to proceed when we see a green light. So it's also about democratic right, but because of the collective profit, because of the collective benefit, we have to follow these rules. And for me, especially in all people who are engaging in this field to deal with COVID-19, we have to see a sort of mandatory about vaccination.
Thank you so much. Do we have any other questions?
Of course, dear Rocco, we have to start an open discussion about all these conspiracy theories regarding vaccines and the reaction of some parts of our societies. For me, it's a very it's a sort of fear, because so many people in even in European countries, they stay so reluctant about vaccination, regardless of a very scientific science that this is the only way. And here I would like to mention one of my painful experiences in my life when we visited Guinea 2014 for Ebola outbreak. In rural areas, we saw people there because they were completely in denial regarding Ebola, and they believed that Ebola was a conspiracy from West to destroy the sovereignty of their country. They killed humanitarian workers. So this issue and this challenge is it's so important to deal with this, and I think maybe it's a good idea to plan a new discussion with with experts about psychology, about sociology, in order to understand this new way of thinking against scientific results and again so obvious results in these issues. For me, it's something which it's really going beyond my understanding sometimes. Sorry, but I'm really strict because I strongly believe that we have to deal with this problem because it is a problem.
I absolutely agree with you, and I think it's about this multidisciplinary approach. You know, getting different social sciences to feed into the discussions rather than just having discussions driven by certain groups. As a last question, I would like to give John Bowis the chance to ask his question.
Thank you, Rocco, and thank you to Christos for his work as Commissioner and indeed his presentation this morning. My experience as a policymaker is that COVID has brought a better understanding of and between diseases and disorders, their interconnections, in other words. Diabetes led to a worse experience of COVID, and COVID is leading to new diagnoses of diabetes. Heart, stroke, diabetes, depression, cancer, so often concurrent or linked, and yet we continue to live and to work and to diagnose in silos, and likewise between health and social care. My question to you is, can this now end or at least change, and will it?
Thank you, my dear colleague, for your questions. And of course, I completely agree with you in your first part of your intervention. I'm a little bit reluctant to enter in this field because I'm not very well informed, unfortunately. And give me the chance to have a call or by email in order to talk more about this, because I'm really now not enough informed to talk this issue. Okay?
Okay, that's fine.
Thank you. Thank you so much. Thank you so much.
Fantastic.
Professor Rocco,
it
was an excellent experience for me.
Yeah, thank you so much for coming to the European Health Policy Group and for participating here as a keynote speaker today. I think your thoughts are incredibly valuable, very insightful, and yeah, I can just say on behalf of the organizing committee, thank you so much for your time and for taking part.
Thank you so much once again for your kind invitation. And of course, if you allow me, I will remain a good friend and close to Health Policy Center at LSE.
Yes, I'm looking forward to hopefully meet you in person sometime soon.
Yes,
and
sometime soon in London. Thank you so much.
Thank you so much.
Goodbye, everybody. Goodbye.